tonight. That means that I will be the one who puts you to sleep for this surgery. Now, I have been told that you have been a little nervous about tonight's procedure, is that right? Yeah, okay. Well, don't worry, if you have any questions, you can always ask me, and I will take the best care of you. Okay. First, I would like to ask you a couple of questions. Yes. So, first of all, again, my name is Dr. Lotta. Over there is Jenny. She will assist me tonight, and I take it you've already met the people who will operate on you. Yes, okay. Good. Now, can you please tell me your name? Okay. And your date of birth? Yes, we always ask that to make sure that we have the right person. There should not be any switch ups, but you never know. Okay, so do you know which procedure will be done on you tonight? Okay. Yes. And the surgeons have spoken with you in detail about how that will take, or how that will go. Yes, perfect. Okay, so for the falling asleep part, the anesthesia part, we will place you under general anesthesia, so you will fall asleep. You will not notice anything during the surgery. You will not be awake. You will not feel pain. It will be just like you're falling asleep, and then when you wake up, everything's done. Of course, there might be some pain afterwards, but there will not be any pain throughout. No awareness, no nothing. Okay, just a very, very deep sleep. So for that, we will obviously take your vital signs throughout the entire procedure. So your blood pressure, your oxygen levels, your pulse, also an EKG, and we will also measure your CO2 levels, so the carbon dioxide levels in the air that you breathe out, to monitor if the ventilation is correct. You will be placed on a ventilator, which will help you breathe, because we will basically relax your body, and that includes your breathing muscles. Okay, good. So you might be aware that there's the type of anesthesia administered via a mask, yes, and there's the one administered via a vein, the one on your arm right there, yes. That's the type that we will use, so you will not need to breathe in any gases, except for oxygen, but I'll get to that later. Okay, so I will tell you what I'm doing. I will give you a painkiller and something to make you fall asleep. Yes. Yes, via your vein. Okay. So, when's the last time you had anything to eat? Okay, last night. And when's the last time you drank any water? This morning, okay. Yes, that's all good. You're allowed to drink water until you're called down into the surgery, actually. It's just the solid foods that you have to lay off of for the day. But as soon as you're back on your normal room that you've been placed in and feeling alright, you may eat. Yeah, you need to be an empty stomach for surgery, because with a full stomach the risk of aspiration, so basically swallowing the wrong way, to put it mildly, is much higher. And so to prevent the risk of swallowing the wrong way, we operate on an empty stomach. Well, you have an empty stomach, I don't. Okay, are you on any medication? Okay. And did you pause that this morning? Perfect. Okay, do you have any medical conditions that we should be aware of? Hay fever. I've got most of it written down here. I'm just checking to see if there's anything that we missed. Do you have any allergies? No, that's perfect. Now, this next one might be a bit weird, but do you have any teeth that you can take out? So like your third set of teeth, because you will need to take that out for the surgery. Okay, and any metal piercings, especially in the mouth area? Any piercings in general? No, okay. Yeah, ear piercings are not really a problem. We recommend taking them out so they don't get lost. But really it's the mouth that interests me. Okay. And have you ever had a surgery done before? And if yes, did you experience any nausea afterwards? Okay. Good. Yeah, in that case, I will give you a medication once you're asleep through your vein that will keep the nausea at bay. There are actually certain risk factors for post-operative nausea. Being female, having a history of post-surgical nausea or like seasickness and that kind of stuff. Being a non-smoker, smoking is a protective factor for that. And I've got the fourth one. Oh yeah, use of opioids in post-surgical pain management, but we're not planning on using opioids for you. Okay. The next question might be a bit uncomfortable, but I have to ask that so that I can adjust the dosage of the anesthesia, of the anesthetic. What's your current weight? Okay, good. That concludes all the questions I had for you. Okay. Now, okay, I'm going to take a look at your eyes. I want you to look at my nose, please. Yes. Okay, and I'm just gonna... Okay. Keep looking at my nose. Okay, very good. Now please open your mouth and put out your tongue as far as it can go. Okay, say ah. Okay, very good. Yes, the opening of the mouth, and especially how well you can see inside the mouth, is important for the process of the intubation, so for the process of putting you on a ventilator. Because if you cannot open your mouth, or you can't really see inside the mouth, maybe because of swelling, it's more difficult to put you on a ventilator. But you're fine, there's no need to worry. Okay, now give me just a second. Okay. Next, I'm going to measure the distance between your chin and your thyroid, and also the distance between your chin and your sternum. Hold still for me, please. I'm checking to see if that's shorter than 6.5 and 12.5 respectively, because again, in that case, intubation might be more difficult. But again, you are absolutely fine. Just let me check again. Yeah, you're fine. Beautiful. Good. Now, I'm going to listen to your heart and lungs again to check for irregularities. Okay. I'm gonna listen to your breathing first. So I want you to breathe through your open mouth, slowly and deeply. Okay. In and out. In and out. Other side. In and out. In and out. Okay, and I'm gonna listen to your back. In and out. Okay. Again, other side. In and out. Okay. And now I'm gonna place my stethoscope on your lower thorax, your lower chest, and I'm gonna ask you to please say 66 in a whispered voice. 66. Okay, 66. And 66. Good. Again, 66. Good. And this side. 66. Good. And again. 66. Good. Very good. Next, I'm going to listen to your heart. For that, I will need to tell you to stop breathing at certain points. Don't worry. Okay. I'm going to place it right here over your heart. Okay, and breathe in and hold. And breathe out. Now, here. Breathe in and hold. And breathe out. I'm also gonna listen to your carotid artery. First on this side. Breathe in and hold. And out. And now this. Breathe in and hold. And breathe out. Beautiful. You can breathe normally now. because it supplies our brain with oxygen. And I was just checking to see if maybe one side was tied, had a stenosis. Do you know what a stenosis is? Yeah, it's basically when the arteries tighter than it should be, and that can constrict the artery and lower the blood flow. But again, you are totally fine, totally fine. And you should never do this, do both at the same time, because putting pressure on both of them at the same time for prolonged periods of time, and by that I mean 3 minutes, will make you pass out, which I will do. I will make you pass out, but not like that. Okay, good. Let me just disinfect my hands. I'm gonna put on some gloves. Because we do want to keep this sterile. Me giving you the medication. Okay. I'm gonna start with the oxygen mask. I'm gonna place that on your face. It's just oxygen, and you can just breathe as you would normal air. This is important because there will be a short period of time. I'm talking like 20 seconds, 30, maximum a minute, during which you will not be breathing, which a normal person can hold their breath for a minute, no problem. But should anything go wrong, not that it will, just should anything go wrong, there is not a lot of, room for error and for adjustment. And by giving you oxygen, which is called pre-oxygenating you, we prolong the period of time during which you can be not breathing. So normally the brain takes damage or gets damage after after 5 minutes you're pretty much brain dead, but after like 2 to 3 to 4 minutes the brain begins taking damage from not breathing, from a lack of oxygen. But by pre-oxygenating you, we can extend that time to 10 minutes. So should anything go wrong during the process of intubation, we have 10 minutes to fix it, which is perfect. And if that doesn't work, then we have other ways. But don't worry, you will not be waking up in 10 minutes, and we will not be telling you, oh, it didn't work. You're back. It will work. Okay, I'm gonna place this over your face now. Okay, over your nose and mouth. And you just keep, okay, I'm just gonna hold this in place. Okay, like that. And you just keep breathing. Yeah, I can breathe with you, that's fine. Just focus on taking deep breaths. You're doing amazing. Yeah. Perfect. Keep breathing. Okay. I'm gonna keep the mask on your face, still there. Gonna keep it that way. You can just keep breathing as you did. You're doing so well. I'm gonna put in the pain medication now, okay? So You will probably start to feel a bit woozy now. Please tell me when. No, okay. Now I'm gonna put in the anesthetic, and then you're gonna fall asleep. Okay. So, if you'd like, we can count together. I have everything connected. So let's count. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. You did so well. See you on the other side. Thank you to my lovely, lovely channel members. Debbie Berry, Fran Wagner, 6A02, Call Me Ash, Stella Stallone, Donata, and Alfie for your support. As always, I am so